All right. In the interest of time, I'm going to go ahead and get us started. I think a few more people will join, but super excited to have you all here this morning. My name is Haley Bell. I'm the training program manager for Telehealth Rocks, and I get to facilitate today's session. We're super excited to have you here for the seventh session of our Echo-like training series, supporting the whole child, connecting brain health systems and practice. Next slide, please. Next slide. There we go. I think it was frozen on my end. Um, Sorry about that. So before we jump in, just a quick reminder kind of what the series is in case you haven't been able to join us before. It is ongoing twice monthly. So we meet on the second Wednesday and the last Thursday of each month. Really looking to build on knowledge over time. And we're working in the whole school, whole community, whole child framework, or the WISC framework, as you might hear us talk about today, really giving us a shared way to think about how systems connect around and support children. And we also want to make sure that the sessions are interactive. So you'll see later today, there is a case-based section, really creating an environment where we can all learn from each other and share, tips and tools to help us along the way. The series is also designed for multiple disciplines and perspectives. So you'll see today that Melissa and Shelby, our two speakers, really bring their own perspective to this topic, and we will plan to carry this throughout the remainder of the series as well. And finally, everything that we will talk about today is really focused on real-world practice and collaboration. I'm really wanting to make sure that each time you guys leave a session, you're able to take that topic and what you learned in it and apply it in your day-to-day work or life. Next slide, please. All right, so I'm super excited to get to introduce today's speakers. So first we have Melissa Maris. Dr. Melissa Maris is a clinical community psychologist who recently joined our team here at Telehealth Rocks as the Director of Community Health Services. So in this role, she provides primary care teleconsultation and oversees the team's community health services funding with a primary focus on advancing WISC implementation and partnerships. Dr. Maris has spent nearly 25 years working on systems level change efforts to build capacity among schools and other youth serving agencies to increase access to quality health and mental health support. So thank you so much, Melissa, for joining us. Super excited to have you. And then we are also joined today by Shelby Nace. Shelby is a social worker by trade and a big feelings person at heart. So with over a decade of experience across public education, child welfare, nonprofit grant management, and trauma-informed therapeutic care, she brings compassion and grounded presence to her role as a staff well-being coordinator for the Park Hill School District. In this role, she toggles between developing innovative mental and emotional health programming that's accessible for all district staff and also offers one-on-one support for staff navigating the well-being landscape, both inside and outside of work. So super excited to have you with us today as well, Shelby. And we'll go on to the next slide. So for our session today, it's going to include a high-level overview of different recommended practices in school staff wellness, including a snapshot of kind of historical trends, ideas to strengthen school staff wellness and evolve current school staff wellness activities. We'll also go through an overview of current staff wellbeing offerings at Park Hill School District and the impact of the expanded program within the first year. For our session today, for the WISC components that we're covering, we're really looking at those employee wellness and community involvement pieces. Next slide. And then before I hand it over to the presenters, just want to quickly review our learning objectives for today. So by the end of the session, you will have explored how employee wellness has evolved and why it matters for staff and student success. You'll also discover the key ingredients of effective workplace wellness strategies. And finally, you'll walk away with at least one practical strategy you can use to support staff well-being in your own setting. So with that, I am going to go ahead and hand it over to Melissa to get us started.
Awesome. Thank you so much, Haley. And hello, everybody. So excited to be here with you this morning. And thank you all for being here, especially because we are nearing the middle of July. And especially for our school friends, I know that this is a challenging time. Not a challenging time, but maybe not a time that you're hopping on a Zoom to talk about staff wellness. But super excited to be here and can't wait to hear from Shelby as she shares some about her experience in Park Hills. Before that, I'm just going to talk a little bit about staff school wellness. If you all are here, I know that you believe too that adult wellness matters in schools, but just kind of to run through these. We know, of course, that adult wellness is a foundation for school success overall. Adult wellness supports staff retention and creates positive school climates that do benefit students. There's lots of research showing that well-supported adults are linked to positive student outcomes. And those adults, when they are well, can build strong relationships, manage classrooms effectively, and enhance student learning. We also know that adult wellness in schools is really important in terms of part of the workforce strategy. Wellness and school wellness support for staff is regularly cited by folks working in schools as being as important, if not more important, than pay, which also improves recruitment and retention. Um, and we'll talk a little bit more about this here shortly, but certainly our school workforce is a constant focus of how we can continue to support the well-being of entire school communities, children and families. If we don't have a strong and well workforce in schools, then none of it's going to work. And then finally, really thinking about a sustainable system approach. Framing wellness as an essential infrastructure encourages long-term system level support for faculty and students. So as Haley mentioned, we are talking about this within the framework of the whole school, whole community, whole child model. And so you can see that there on the screen to the left. Lots of different components there. Employee wellness is one of those components. Employee wellness was also one of the 8 components before with the coordinated school health model and before it evolved into the WISC model. So clearly a recognition there of how important this is. I think also it's helpful to kind of frame employee wellness as connecting, of course, to all of these other components, and especially the ones that are directly related to schools or to students. And so if we think about something like social emotional climate, counseling and psychological and social services for kids, we know that for that to work in schools, staff also have to be present and well and grounded to facilitate all of these other different components with the WISC model. And we're going to be sharing several resources throughout this presentation, and we'll follow up afterwards with these slides and those resource links too. In this slide, they are linked with these pictures here. So just wanted to highlight a couple of them. So Missouri Healthy Schools is a terrific resource site based in the WISC framework, and it goes through each of the components and lists out different resources. There's also an opportunity there to reach out to experts on these different topics and discuss them more. And so would definitely encourage you all to check that out. And then also wanted to highlight this Sophie School employee wellness site. And so Sophie is the Society for Public Health Education. And as school wellness was really gaining traction about 10-ish years ago, they really dove in partnership with the CDC, so the Centers for Disease Control and Prevention, to create specific resources for schools. And there are now a whole lot of resources that really do focus in on schools as a unique context where we need to be thinking about adult wellness in kind of a different way. And this employee wellness resource is really great, very comprehensive, and also has links to lots of other resource databases and lists and things like that. So kind of looking back, and Shelby and I were talking about this just last week of kind of where we've been with school wellness and kind of where we are. I'm sure many of you all have had different experiences in these realms, but thought it would be helpful and maybe just kind of fun to walk through it. When we look back sort of the last decade, so thinking about 2016-ish until now, and we look at those early wellness initiatives. So when staff wellness, it seems like was kind of first starting to gain traction. This is when school wellness committees were starting to get formed. And at least in my experience, a lot of those early efforts really focused on staff or employee wellness. But a lot of those initiatives were very individually focused. And so doing things like fitness challenges, stress workshops, wellness fairs, having a professional development devoted to kind of the stereotypical self-care, so a massage chair or having somebody come in to lead, a Zumba class. And that was really kind of the focus at that time. And since then, there really has been a shift to an organizational focus. And from my experience, this was really kind of in reaction to feedback from school folks and then other folks who said, it's not very helpful to tell, stressed out teachers that they should just take care of themselves and that everything's going to be better if they can just walk around, the track a few times during their lunch break. And so just, kind of some pushback around that, and also a recognition that organizationally and at that organizational level, it's helpful and important and really economically sound to look at the organizational focus, and really that it's very, very difficult for individuals to focus on wellness when the organization isn't there supporting them. And this, of course, is true not just in schools, but in all organizations. And so looking at how the context could really support the individual actions, not in any way taking away from those individual actions. I love a good wellness fair still, but also what's going to happen the day after that or the next week. How will this happen next year? So this question around sustainability also started to come up. We also started to see a really strong focus on incorporating psychological safety. So a lot of this happened through Trauma Informed Schools initiative and other areas, and looking at staff voice and choice, looking at SAMHSA's 3T trauma model, and trying to figure out how to incorporate these different components of safety, empowerment voice into school wellness approaches. And so, I think probably all of the trauma-informed schools work that I ever did always had a focus somewhere in there on staff wellness, which was certainly a shift from kind of, the 10 years before that really was focused solely on student wellness, and kind of the staff wellness was a little bit of an afterthought. And then finally, certainly the pandemic-driven awareness. And so we're going to talk about this a little bit more in a second. But COVID-19 really did highlight chronic stress and emotional exhaustion, and also created a lot more resources outside of schools that schools very quickly picked up on and started to incorporate into their own policies and processes and programs. Um, and so kind of thinking about this, we go from healthy teachers support healthy and successful students as being kind of the sole focus, to this shift towards staff wellness impacts overall organizational functioning, and really looking at workforce shortages as a significant challenge to public education. And then also kind of looking at the bottom line. And so looking at money. It costs a lot for schools to recruit and retain teachers. And so that staff turnover does have a dollar sign attached to it. And so talking about that or thinking about that from my perspective doesn't make it gross or dirty. It's just real. And also we know that numbers, so student outcomes and dollars often are driving or very much informing kind of decisions at the district level and certainly at the state and national levels. And so talking about those numbers and how it's connected to staff wellness makes a lot of sense. And then finally, looking at trauma-informed efforts that really focused on everyone in the school community. So we've always in schools been focused on the children, adolescents, and then certainly family engagement, but also that recognition that the adults in the school are also part of the school community. And just wanted to highlight one of the kind of ahas for me kind of early on in this work was in rural schools and communities where you really do see, and not that it doesn't exist everywhere, but you really do see, that the teachers have kids who are in the school. And so they are both staff and families of those students. And then over time that those students grow up and they come back to teach in the school. And so it really is kind of all interconnected. And it's been really fun to learn with and from a lot of rural schools and kind of look at what they're doing in those ways. So just a little bit more about COVID. Of course, there was a huge impact of the pandemic on staff wellness. It made the pandemic totally changed and transformed what it looked like to work in a school, just like it transformed all of our lives, and really looking at how it increased workload, emotional labor, and that did make staff wellness a higher priority. And again, a lot of learning from healthcare settings in terms of what those professionals were doing to try to keep that workforce healthy and engaged and at work, and kind of taking that into schools. And so there have been ongoing wellness challenges. So certainly there's a lot of discussion now about job-related stress and burnout um, due to staff shortages and a whole lot of other contextual challenges. And I don't need to kind of walk through all of these, but these are just some examples. Of course, funding and funding shifts, the post-pandemic funding that came to schools and now has mostly sunsetted. And so it just feels like there's a lot of it's a very dynamic situation that's constantly changing. And we know that consistent and predictable environments are really good for our well-being. And certainly these broader contextual challenges are making that a little bit more challenging. And then again, that organizational responsibility shift. And so really looking at the district level, at the state level and our state departments of education, a real focus on employee wellness as a strategy to support school success, kind of broadly writ. So in terms of kind of some general recommended practices for staff wellness, you can see these here. I think one of the things that perhaps is a take home for me is that the same things that support student initiatives, student wellness initiatives, student academic success initiatives are the same things that support staff wellness. So of course, clear leadership commitment, and certainly from the top down, bottom up, side to side. It really does look different when a school leader is committed to wellness. They talk differently, they act differently, they make different choices, and have different conversations, and what they prioritize is really different. Certainly, staff engagement. So we see now a lot more engagement of staff in terms of getting feedback around what staff really need and want, and that helps in terms of engagement, buy-in. Um, really looking at mental health support. And so not just looking at physical wellness, but kind of this more holistic perspective, not just for the whole child, but also the whole teacher kind of idea. Also talking about mental health support in any way normalizes mental health challenges, and also continues to address stigma, which we all know is still very prominent in terms of a barrier, really, in addressing mental health challenges in our communities, and organizational conditions. So, kind of recognizing that how we structure our days and how we structure our buildings and kind of those sort of infrastructure pieces really does matter. And so thinking about how we can look at flexible scheduling if that's a possibility, things like that. And really even like pretty basic things you would think of, if a teacher is in their classroom and they're the only adult there, what do they do if they need to go to the bathroom? Like, how do we support that? Can we have something like a floating sub who can really just walk around and support teachers and say, hey, I can stand here and I can be here for a few minutes if you need to go take care of things, check in on your family, go to the bathroom, take a walk, and those sorts of things, and really looking at a whole school approach to adult wellness. So I knew I needed to put the stoplight triangle somewhere in this presentation, but I do think it's helpful when we think about adult wellness to really look at how we think about and work towards student wellness, and then try to do the same things. And so looking at how what we can do to support staff wellness for all staff, and then kind of thinking about that tiered model. It's also really nice when we have initiatives that parallel in kind of these different concepts. So once you understand the public health framework, then this can be applied everywhere. And really just that idea, we want to start with, what is low cost, low time that everybody gets, and then kind of work from there to increase intensity. So again, looking at integrated wellness frameworks, this is not something different than other things. It's incorporated common language, common tools, common graphics. looking at multiple wellness dimensions. And so physical, emotional, social, and also basic needs. And I'm saying basic as in finances, housing, legal paperwork, wills, just all the things that in the real world as humans we deal with all the time, and how we really can support staff in schools and elsewhere by giving them some tools and helping them use those tools. Really looking at equity in wellness. So coming up with wellness approaches that address, diverse needs for everyone. And so thinking about the different needs that might surface from, say, a district superintendent versus a support staff, and kind of what that looks like. I think this is a lot too about access and making sure that when we have resources that we are looking at barriers to access and trying to problem solve through those. A lot of times our best intentions kind of halfway work and halfway don't. And so just continuing to look at what we're doing, who it is impacting, who it's not, and why, and just kind of continuous quality improvement of trying to continue to strengthen and evolve those practices. And then really looking at sustainable wellness systems. So looking at things that can continue over time. This is the classic, it's great to do a training once, but then what happens next year? And so what are we doing to sustain that? And that often pushes us more towards systemic changes in terms of policies, processes, and programs. And then real quick, and then I'm going to hand it over to Shelby. Thought it would be helpful, and there are a number of tools that you can do this kind of in a more systematic fashion. But in terms of kind of looking, kind of quick glance, kind of staff wellness in your school or a school that you work with or a school that you love, these are kind of some initial components you might want to consider. So it's, really a fantastic idea and kind of fundamental to have a wellness team. So this is a team of people who are in the school. It's great to have community folks involved too, who are focused specifically on wellness. And I would say that can be wellness kind of broadly described. Also, if you don't have a wellness team, it doesn't mean that you have to create a whole new team. I actually strongly advocate against creating whole new teams for any reason, unless you absolutely have to. But looking at who could be doing this, and there's likely some group in every district, even if it's a group of, say, a school counselor and a school principal, who are already talking about wellness, things like wellness policies, looking at them, and again, setting some goals around staff wellness specifically that can be measured and tracked, and then again, can inform that quality improvement process. Looking at mental health supports specifically. So looking at, are those supports visible? If you do have an employee assistance program or an EAP, are those supports highlighted? We know that it's going to take more work and effort for folks to access mental health supports than other kinds of supports, again, associated with the stigma around mental health and those challenges. And so really looking at how to prioritize those and center them, just to increase awareness, and really walking through step by step how folks can access those supports. Looking at recognition and professional development. And so kind of this idea that as humans, we all want to show up in places where we are seen and where we can do good things and contribute, and those contributions are recognized. And so a lot of times, recognition goes by the wayside with other components, but it's often a really easy in terms of celebrating the successes, and doing that all the time over and over again, and really incorporating that into ongoing professional development. And again, looking at that data review and continuous improvement, that we're just constantly looking and saying, hey, we tried this thing, it worked it kind of didn't. What do we do next time? How do we improve? How do we get more eyes on this, or voices providing input in terms of how we could continue to improve this? And so this link over here, this CDC Worksite Health Scorecard, is one of a number of resources that can be used to more, again, systematically and methodically go through and assess a school wellness program. But these are kind of some of the things that I try to look for when somebody is initially talking about staff wellness and looking at the quality of their staff wellness program. And so with that, Shelby, I will hand it over to you.
Thank you so much. And I love how we've kind of done this big overview of what staff wellness looks like, or is kind of a broad overview. And now I'm going to kind of zoom in a little bit and explain sort of what my role is in my district. I'm a little bit biased, but I feel like we're doing a lot of really good things. And so I'm really proud of that. And I'm kind of excited to share that with you guys. So just to give you a little bit of background, so I'm Shelby, I'm a social worker by trade, but I am the staff wellbeing coordinator for Park Hill School District. We are a suburban school district. We're north of Kansas City, Missouri in southern Platte County. So I'm giving you like just a little bit of what we look like on a map. We serve approximately 12,000 pre-K to 12 students within 2 comprehensive high schools. We have 1 innovative personalized high school program, 4 middle schools, 12 elementary schools, an early education center, and 1 therapeutic day school. And then within that, we also have about 2,000 staff members. That's, fluctuates day to day. But that's about 1,000 certificated staff. And then we have roughly 1,000 support and operational staff. So that's just kind of an overview of what we're looking at here. And I was really lucky when I came into this role last year. So full disclosure, I've been in this role for 1 year. It's a brand new position. But prior to this, we did already have a really robust employee wellness program. We had a health enhancement coordinator who runs our fitness center. She kind of coordinates our annual health screenings, a lot of district-wide health challenges. She does metabolic testing for our staff when they request it. And then at that time, she was also kind of in charge of promoting our employee assistance program. So she had a really big job, and most of that program was really aimed at helping our employees manage their physical health and wellness, which we know that there's, mental benefits to that as well. But again, primarily focused on that physical health and wellness. And that role, the health enhancement coordinator role, had been established in 2008 when our district opted to put in our employee fitness center, which is on site at our district office. It's pretty small, but it's still, we're proud of it. And so again, I was walking into a program that had a really, was really robust and well established. We also had a pretty comprehensive benefits package that was subsidized by our Board of Education. So they were doing a lot of things right already, but they were still finding that a little bit more was needed. So we can go to the next slide. So several things preempted this addition of a dedicated social worker for staff. Not one of those things being COVID, right? So we kind of came back from COVID-19 and started kind of quote unquote getting back to normal, right? Whatever that looks like for us. But we were finding that staff were coming back with a lot more mental health issues, and there was a lot more talk about burnout and stress. We also, as a district, just experienced several years in a row of really big district-wide tragedies. So we had student and staff deaths, and that was really tough on our staff and our community. Our community is a big part of our district. We have a lot of teachers who live and work and whose children go to schools here. So we're really kind of integrated, and we had a lot of big events that really feel like they rocked our school district and had a big impact on everybody's mental health. Along the same lines, we also around that time began the rollout of restorative practices in our district, which I'll talk a little bit more about that later, how that sort of influenced a lot of what I aimed to do when I got here. But we were already kind of headed that direction of learning that the adults really needed to embrace this work just as much as with themselves as with the students. But all that to say, we were finding that we really needed more in terms of employee mental health. So our health enhancement coordinator, that role that was very focused on physical health, she was getting really bombarded with a lot of questions and a lot of people coming to her with these big issues. And she said, well, part of this, I worked in corporate wellness. Like, I do not have the background for this. And I really appreciate that she was like, this is more than I can handle. So those conversations started happening, and luckily we were, I'm again really proud of our board and our leadership because they really embraced the need for this as well. So after several years of working with various district teams, we put together this, or rather they put together this job description for the role. So what they wanted was someone who could promote and provide access to staff wellbeing resources, collaborate with stakeholders to support employee wellness initiatives, offer short-term emergency support to staff in need, educate staff on a variety of wellbeing topics, manage and mediate workplace conflicts, and respond to critical incidents. The goal of the role was to really foster a supportive work environment, cultivate meaningful connections among the staff, and build a strong sense of belonging in the district. So that's another big thing with our district that we emphasize quite a bit with our students and staff is that sense of belonging. Next slide, please. Okay, so then when I came in, what does that look like in practice, right? We have all these big ideas about these different aspects of the role, but what do we want that to look like? So right after being hired in the role in July of 2025, I began this process of strategic planning. So taking the framework provided by the district, I drew from a variety of tools, which there's some links to a few things that we can throw in the chat here whenever we get a chance. So one of those being the Missouri Department of Mental Health framework for mental health and employee wellness. We took some of those kind of big pieces there. We also used Wellness Alliance's 7 benchmarks for workplace wellness. And then that's formerly, it used to be called WellCOA, but now they're the Wellness Alliance. So we use a lot of their resources as well. And then again, we also pulled from restorative practices quite a bit. So we wanted this role to look a lot like our restorative practices did in school. So being able to have those sit-down conversations with individual people, with groups, to be able to kind of really hear what people were needing. So I spent a lot of time in those first few months listening to district leaders, forming community partnerships with other agencies in the area that I could refer out to, surveying the district. We're already kind of notorious for surveys, but we sent out a lot of surveys, and really just trying to make an effort to get this position out, like letting people know that this existed. So even now, being here a full year, like I feel like I'm constantly advertising, like, hey, this is a service that we offer. And people still are like, oh, I didn't know we had that. And I'm like, okay, no one's reading my newsletters. But people are, and it takes a while to get the knowledge out there and that sort of thing. And that's just part of it. So what this ended up sort of looking like were me being able to offer individualized staff well-being appointments. Those appointments oftentimes include a needs assessment, identification of resources individual to that person. A lot of times we make self-care and safety plans if they're needed. And then we navigate sort of mental health options for staff within school. So maybe using our EAP program or maybe being referred out using something that takes our insurance that we offer, looking at different options that way. And then just talking through specific challenges. The thing that I found is that most people just wanted to be heard and wanted to have their individual needs met. So that is a big job with 2,000 staff members. But again, not everyone takes advantage, and it's kind of a word of mouth a lot of times. People say, oh, I had a really good appointment. She was able to help me find this and this. And it kind of spreads that way. We also, again, do a lot of showing up at staff meetings, showing up with new teacher trainings, different things like that. But then we put out a monthly newsletter. So a lot of times that includes various resources like spotlighting community resources, providing reading guides for like relevant books or wellness topics, and then different upcoming events, promoting different upcoming wellness events that we have. We've also kind of started some new programs, including on-site staff support groups. I'm running 2 of those this summer. One is for neurodivergence in adults in education. So that one's going really well right now. And then we also have a grief and loss group. Again, I provide on-site crisis and support for different critical incidents. So again, this year we had, unfortunately, another student death. I was able to be on site for that school at that time for kind of as long as they needed. I can provide professional development on a variety of different well-being topics. And then actually after next week, so I'm going to get trained in restorative conferencing, and then I will be able to do restorative conferences to kind of mediate staff to staff conflicts, which I'm really excited about. That should be really interesting. So I'm excited to see how that goes. Next slide, please. We also made just a couple of changes and kind of updated the staff wellbeing program. So it used to be called just the employee wellness program. We're now calling it the staff wellbeing program. And we decided to kind of change that because the word wellness oftentimes refers specifically to health. Being in the state of good health is an actively pursued goal. And Park Hill, again, had done a really good job establishing its health programming, its physical health programming, but we thought that well-being might sort of broaden that definition a little bit and kind of be defined as the state of being comfortable and healthy and happy. So embracing those other dimensions, including physical, emotional, social, and maybe even spiritual wellness, and really seeing our employees as a whole person and not just a staff member. So what are our key takeaways? So many things, right? But one of the biggest things that it seems sort of obvious, but I think we don't often take the time to acknowledge is that our staff oftentimes have many of the same needs as our families, right? So they're helping their families through different issues and financial stress and all kinds of things and offering these different programs, but sometimes staff need those same things. Another key thing has been that trust and confidentiality are really key to providing these supports. So, anything that's said in my office, I make very clear, unless there's a safety concern, what happens in my office stays in my office. And that has to really be honored for people to feel safe and comfortable, kind of creating, again, that sense of psychological safety. Many of our staff really do just need to feel seen and be heard. And then, the staff also were very willing to be vulnerable. I was so surprised early on what people were willing to disclose. And of course, that only goes to a point. This is still, we're still at work. And so there is a little bit of a barrier there, but also staff are really willing to utilize the support. And then the last thing that I think is extremely important right now, especially post-COVID, when we had a lot of online supports and kind of a lack of human connection during a time when AI and technology are huge. Many of those services are being automated and staff really appreciate a human touch. They really appreciate someone sitting down with them and listening face to face. So those were just a few things that were really pertinent in my first year. And I think I'm going to hand it back over to Haley to do just a little transition to our case.
Yes, thank you so much, Shelby. I appreciate that and love to hear the different key takeaways from your first year. We can go on to the next slide. So we're gonna transition into our case discussion. So really this is just a time, like I said, we're gonna talk through a case example and then we have some discussion questions. We'd love to have you guys interact with the case. You'll see the discussion questions here in just a second. Feel free to type in the chat or come off of mute. We are a smaller group, so definitely welcome. If coming off mute is just easier, feel free to do that as well. And yeah, any questions you have during this time too, you can put those in the chat. And if we have time at the end, we will address those. And I can go ahead and Shelby, pass it back to you if you want to jump into the case.
Thank you. So this is just sort of an example of something that is very typical to what might happen in our district. So obviously any names or identifying information has been changed, but very realistic scenario for us. So Kara, 23-year-old female, a paraprofessional in a school district, is working alongside a teacher in a fourth grade classroom. One day during class, the teacher stepped out to use the bathroom and make some copies and asked Tara to walk the class through their assignment. While explaining the assignment, Jane, a student in the classroom, interrupted Tara several times to ask clarifying questions. Tara, visibly frustrated, raised her voice at Jane and told her not to ask another question or she'd be sent to the office. When the assignment was graded and returned, Jane received a poor grade, which sparked some discussion between her and her mother about what had happened. Jane's mother then emailed her teacher, who realized that Tara was at fault here. The teacher, who had recently taken note of Tara looking a little tired and showing up late to work, went directly to her principal to make a complaint. The principal was surprised as Tara had a good work history and never received previous complaints. In turn, the principal scheduled a meeting with Tara to discuss her performance. During this meeting, Tara became visibly upset and cries, explaining that she's been under a lot of emotional and financial stress at home, but hoped to be getting things in order soon. Rather than disciplining Tara or prodding Tara to say more about what was going on, the principal told Tara about a new service in the district, staff well-being appointments. Tara agrees to make one. After completing a needs assessment and discussing confidentiality, Tara disclosed to the staff well-being coordinator in her appointment that she's currently staying at her sister's house with her children, both of whom attend schools in the district, because she's experienced domestic violence at the hands of her children's father. Tara notes that it's been hard since her sister also has children and the house is very chaotic. Tara's been unable to sleep and has even considered going back to live in her children's father's home, despite her family encouraging her to file a protection order. The staff well-being coordinator listens, validates concerns, and asks if it's okay to share some local resources with Tara. She agrees, and together they make a plan to ensure Tara and her children's safety, find housing and help with groceries and other basic needs, and get the family into therapy services. Once they have a plan in place, Tara also agrees that a protection order may be a good idea, and together they complete the form. Tara agrees to bring it in person to file it that evening.
Okay, thank you, Shelby. So two discussion questions here, and really this is just an open forum to talk or to share any questions you might have, and kind of to talk together about this case, and what we might learn from it in terms of staff wellness overall. So the first question is, what do you imagine follow-up might look like in this case? And Haley's going to help us by reading the chat, because there's a lot of buttons on my computer and I don't want to launch a rocket.
Yeah, so feel free, drop in the chat, or like I said earlier, feel free to come off mute as well. Would love to hear what you guys think might next steps might be.
Shelby, as our friends here are thinking about this question, I wonder if you could say in a situation like this, or in this situation or a situation like it, kind of what the time frame was for everything that you talked about thus far. And so, this, I understand like the interaction up until the point that Tara comes in and meets with the staff well-being coordinator, but like how long does that next step take?
Yeah, so usually I'll get a referral either from, maybe the principal or maybe Tara reached out directly. It kind of depends on their willingness. But oftentimes, especially if there's something like this where somebody seems particularly stressed, even if they haven't yet disclosed the reason for that, I'll try to get them in within the next day or within 48 hours, but for sure within the same school week. So oftentimes that looks like my schedule being very flexible, but trying to leave time to make sure that I can kind of see staff on that as needed basis. Does that sort of answer? I hope that answers.
Yeah, no, yeah. I think sometimes when, when we describe a case, it sounds so, I don't know, like packaged. So it's just helpful to think time frame. And then also, I think that's often a question of kind of these sorts of referral options and resources at schools is kind of how long does XYZ take? Is there a wait list? And those things. So it sounds like you're able to be very responsive, which I'm sure also then helps in return for whoever is referring or people coming in to seek support, that it's pretty fast.
Yeah. Yeah.
Jeff also shared in the chat, maybe follow-up looks like checking in with Tara the following week to see how she's doing and if there are any other needs that have arisen in the meantime.
Absolutely. I think one of the things about this is, this is a sort of a perfect example, right, where they got in and we got all these resources together same day. And that's not always what it looks like, right? So oftentimes it's like, okay, we got XYZ taken care of, and I'm going to check in with you in a couple of days, make sure you've got that order of protection filed, make sure you're still safe. But it doesn't always get wrapped up in a nice little bow, and oftentimes they have to come back several times before it really feels like they're they have everything that they need. I think it's also really helpful for staff to know that someone is going to check in and say, hey, I know I gave you these resources. That was kind of a lot at one time. That was a lot to process. You still doing okay? Do you want to talk through these more individually? Just kind of giving them a little bit of space too.
Thanks, Shelby. I know Jennifer as well had said maybe if a tentative plan has been made during that initial conversation, whether that's filing a protective order, scheduling therapy, legal appointments, kind of whatever you talked about in that first session, maybe just checking in to see what's been done and if there are additional supports needed to complete the task that you talked through. And Leslie, I had a good comment too. A lot of the times the services equal paperwork, lots of it. And so which can be really overwhelming if someone's experiencing a crisis. I appreciate you putting that out too, Leslie.
Yeah, a lot of my job actually ends up being really just sitting with people while they fill out paperwork. Because a lot of times they're like, am I doing this right? What does this question mean? Those kinds of questions. And it's just really helpful to have somebody sitting with you to do it. Again, part of that human touch.
Looks like Nikisha said maybe understanding what Tara's financial situation may also be, like that might be important too, to see if she can access different grants, maybe to ease the burden, as we know how much of a stressor for finances can be. Leslie had a good idea too, maybe connecting Tara with a community health worker to maybe provide some additional supports as well.
Yeah, one other thing that I end up feeling like I do a lot of is, I don't have capacity to do everything, right? And nor should it be like one specific person's job, but a lot of what I do is what I like to call a warm handoff, right? So I have a relationship with, somebody at the health department and or somebody at one of our local domestic violence shelters, and I say, hey, I've got somebody here, and I can give them a name. It feels a little bit better to people, I think, than just handing them the phone number and say, okay, call them when you're ready.
Mm-hmm. Yeah, no, I think that's a really good point, Shelby. And yeah, the human touch piece. I also really appreciate what you said about filling out the paperwork. And I mean, I know that for filling out any paperwork, it helps if somebody's sitting there. So, yep, that seems like you could put it there. That seems like a rational choice there.
Yeah.
But yeah, the other thing, and I had not a similar case last year, but a case where there was kind of a disclosure around trauma. And one of the things that was sort of a light bulb moment for me was in that warm handoff component. And I guess this would be more of even like a direct referral. I sought out the person who was seeking support and sought their permission to actually give a heads up of kind of a rough outline of what was going on, so they didn't have to read it. And that being one of those things that often is really difficult for folks who have experienced any kind of violence in the home or any kind of trauma really at all. And so that was kind of one of those like, oh, this is super helpful. And that, of course, that didn't mean like that they were not ever going to have to talk about it again, but and that way somebody knows, and they don't have to immediately go in, meet a new person who they don't know, and then again disclose all of this information.
Yeah, if there's one thing that I learned in working in child welfare, I used to be a forensic interviewer in a different lifetime, and it is people do not want to tell their stories over and over again. So having that level of warm handoff with permission is so valuable.
Hmm. I wonder, maybe we can move. Well, first, I had another question about follow-up.
Yeah.
So we are talking now about the Terra follow-up. I wonder if you could speak a little bit to kind of the other types of follow-up. So, you mentioned Terra has two kids who are also in the district. So now this is part of our school family. And then also kind of maybe follow up with if it's the principal who referred her, like, do you follow up with the principal? And then what do you say? What about with like the teacher who was initially upset? Like what, it seems like there's a lot of follow-up that could happen.
Yeah, that's a really good point, and it is so I feel like I don't have a straight answer for this because it is so individualized case to case. And again, it depends on the situation. A lot of times, especially with stuff like this, I try to be very sensitive to confidentiality. So Tara didn't disclose this information to her principal. Maybe she doesn't want her principal to know. But in that process, I might say, hey, are there other people that you can talk to about what's going on? Is it okay if we talk to your principal and just give them a heads up that, if you're not at work one day, there might be a safety concern? Um, and so it really just kind of depends on what that person is comfortable with. And a lot of times as we form more of a relationship, they're more likely to kind of agree to some of those things. So again, this is a long-term relationship. This is, not a one and done. This is, I'm going to follow up with you in a month and, after I've checked in with you several times and say, okay, where are we at? You feel a little more stable with this, but how are your kids doing? Are they having issues at school? Can we get some supports in place for them? Yes, that absolutely. A lot of times it does end up being that, and more often than not, people are really open to like, I don't care who knows, I just want to get the support. Um, but it's a sticky situation sometimes if people want to protect you know, their their stuff. They don't always want everybody to know.
Yeah, no, that makes a lot of sense. Um, so let's spend a few minutes talking about this next question. So, how might a similar case have played out in your own work? What barriers are there to supporting staff in this way? I always like to joke on presentations like this when we're waiting for questions to pop up that as clinicians we have terrific wait time. And so, and also, like, I could talk to you for hours. And so we can just fill this right up as well. But I think you also just wanted to acknowledge, like, you kind of addressed one of these, right? In terms of the barriers, supporting staff, kind of how you manage this sensitive information. And it's different than if you were in a community-based setting and there weren't any connections to the workplace at all. But here you have, multiple staff involved, school leadership involved, students involved, so then also their teachers. You have, dad by like custody. I mean, there are just so many safety concerns, so many issues that just make it kind of sensitive and sort of spiky. And just it seems like there's a lot of places where you could misstep. And I think that's often a reason why people don't kind of they create sort of, very, very strong boundaries around these things because of sort of those what if situations. So I really appreciate your willingness to kind of move into those spaces with these school friends and also, and you said it as well, but like your district support of that. Because without that, and you know this too, like it wouldn't be possible.
Yeah, yeah, and I feel very lucky, and most of our school leadership, like our principals even, they understand the importance of this, and I feel really lucky to know that. A lot of, and I meant to mention this earlier. But before I came into this role, a lot of our school social workers were doing this for staff, and it
Mm.
put them in a really sticky position because they're part of that school community. So one of the benefits of me, although I am part of the district community, I'm not tied to any one individual school. I also, my office is kind of in a different location, right? So we rent some space, weirdly enough, in Zona Rosa, which if you're familiar with Kansas City at all, it's like a shopping, like an outdoor shopping center. And so we rent some space here. There's other district offices here, but it's a little quieter than our district office because for a lot of people, district office feels like, oh, what are you doing here? Like, are you in trouble? You know, it's like going to the principal's office for an adult. So this is a little more private, and people can kind of have that space and separation from their school building.
Yeah, and I love how you mentioned kind of the role differentiation between, and I hear this a lot too from school counselors who are health teachers, who are approached and asked, adult wellness kinds of questions or these things, and that's when it does create sort of these really tricky. Now I know this information, and what am I going to do with it? I have to do something with it now that I know. But kind of being able to manage that and balance and juggle all of these different roles um, across the board.
Looking at some of our response in the chat, Jennifer shared that at their organization, they don't have any identified support for the staff besides the two principals and counselor, who obviously have a lot of other responsibilities that they're trying to juggle. So in this situation, there likely would have been attempts at support, but probably wouldn't have been able to have been made a priority. So I think it's nice, Shelby, like with your role talking through, that this is like your dedicated time and what you're working on is super nice and super exciting. Jeff also shared that in his workplace, counseling options would have been provided for both mom and the children in the home. So appreciate you sharing that too, Jeff.
I feel very privileged that I this is my role and this is what I get to do because I love doing it, and it is again very it's not something that everybody has access to or will have access to. But I think even just knowing, like, okay, if a need like this arises, we do have a plan for it, right? Our principal will tackle this, or our school counselor will tackle this. Again, it's not their primary job. They shouldn't have to have that extra responsibility, but just knowing how it's going to be handled so that it's handled the same way every time is helpful.
Mhm. That's a really good point too, Shelby. So thank you everybody for your comments and questions. And Shelby, thank you so much for bringing that case to us and letting us chat through it. And Haley, I will hand this back to you.
Yeah, so really quickly, we're just going to run through a few of the key takeaways for today. So Shelby, I'll give it back to you. You want to start with yours, and then Melissa, if you want to cover yours as well.
Yeah, absolutely. So really just the idea that staff well-being is student well-being. Our staff, when they are well and have capacity, are so much better able to sit with and be with our students in a intentional way.
And then also the idea that well-being is multifaceted. I think, Shelby, everything you said, even about kind of how you all define, employee wellness versus well-being, and not forgetting the basics. So again, many of our staff have the same needs as families. These are not necessarily distinct and separate populations. And so the basics of safety, housing, finances, food insecurity, these kind of things are something that anybody can be struggling with for a lot of different reasons. And then finally, I think sometimes it's so fantastic to hear about all the resources and all the great things happening. And then I think it can feel kind of overwhelming too, of sort of what to do next. There's so many options, it seems. And so I think this is just general kind of take home of the most important thing is to start or to continue, right? Just to do a thing. And then eventually, how do you eat an elephant one bite at a time? Like you'll eventually grow it over time. And so also just want to celebrate all that all of you all are already doing to support the well-being of adults and young people who are in your different contexts. So thank you for that.
Thank you both so much. Really just want to say thank you guys too for sharing your expertise today with us, and Shelby, getting to hear about what you're doing in your district as well. So before we wrap up, I know we've got just a few minutes. As part of the series, we would love to get your feedback on today's session. So please feel free to either scan the QR code, or I just dropped a link in the chat. It's a very brief survey, really just letting you have the opportunity to share your thoughts and experiences on today's session and our speakers. And then I'll go ahead and have us move to the next slide, please. So before I'll let you go, just want to highlight the next session. Our next session is going to be on July 30th at 12 p.m. And it will be looking at employment as a health outcome. So we'd love to have you join us with Amanda Ramsey and Monica Cohen. And then we will also have a panel of employers talking through this topic. So super excited, really emphasizing the importance of supporting youth with disabilities. For today's session, really quickly, just letting you know, you will get a follow-up email that has that link to the feedback survey, as well as a copy of the slides, the resources that Melissa and Shelby shared today, and then a link to the session recording, as well as a certificate of attendance. Just give us a little bit of time to get those sent out, and then they should be in your inbox. But yeah, just wanted to say thank you again, Melissa and Shelby, and thank you all to joining us. We really look forward to seeing you all next time on July 30th at 12 p.m. So hope you guys have a good rest of your day. Thanks.
Thank you.
Thanks, everybody.